in the article, I think you were quoted in the Times, you said it was not unreasonable to expect 50,000 users to be on at the same time. This was the government's goal. They've reached that. What is the reasonable expectation as it stands now of what people should expect moving ahead with these slight improvements that we're seeing?
Well, I'm really hoping that as a user and a taxpayer that, this system works properly. As of today, I still haven't been able to log into the system because it's been too busy. So I'm not sure about the changes that they've made. But still talking about error rates, and I'm not really sure how you deploy a website with known levels of errors. Applications either work or they don't work. So I'm not sure if they're still in a state where they're expecting 1% of the people to fail for unknown reasons, or people will enter in certain things they know will fail, and they only expect 1% of the people to do that.
And you said you attempted to get on today and you were unable to do so?
Correct.
And was this your first time trying to get on the website?
I've been trying since the weekend. I've seen some improvements where they created a whole new area which could give you an estimate for unsubsidized pricing based on your age and your family demographics, which is great. However, they have a button where you could press to apply, and it sends you back into the system to log back in. But if you're not getting a subsidy,
to that point, you don't count that as getting onto the website? I mean, you're describing things that go beyond error message, which is what we saw all last week.
Right.
And prior to.
So that's a step forward,
okay.
But I still didn't see the way to actually buy. For instance, if you don't need a subsidy, why do you need to be in the system anymore? You should just be, siphoned off directly to the insurance company. So
at this point, the White House says 375,000 visitors have gone on to Healthcare.gov Monday by noon. That's the new number, Luke, that the Jay Carney just cited, 375,000 since noon. Is that an unimpressive number to you, as speaking as a person who tried to get on and from your technical background?
Right. I mean, those are very manageable numbers for modern websites, so that's great. I'm sure lots of people will be getting on just to shop, as they would on Black Monday on any other e-commerce website. People need to shop, need to compare. I think they've done some better things in comparing plans. This is a long, drawn-out process. This isn't buying a book on a website. People need to examine these plans carefully, see if their doctors are on it.
Just as I did when I signed up for my health care here. I mean, as I've stated many times, if you've ever gotten a job where you have health care, we all know you turn to the person in the cubicle next to you and you're like, do you understand this? What's going on here? That is across the board. If you've ever filled out, government or not, any insurance form for any company.
Absolutely. It's not a one-click process, so the marketplace is really important.
All right. Well, thank you very much for your time. I really appreciate it, Luke.